Welcome to week 4. Last week, we generated creative ideas through human-centered design. Those ideas are exciting, but excitement isn't enough. Now we need to structure our innovation. We need to translate creative concepts into actionable plans. This week is about logic models and strategic alignment, ensuring that every element of our program connects logically to the outcomes we want to achieve. We begin with goals and objectives. These are the foundation of any program plan. Without clear objectives, you can't measure success. You can't know if you're on track. You can't hold anyone accountable. Let's learn how to write objectives that work. By the end of this lesson, you'll accomplish 3 objectives. First, write objectives that meet all SMART criteria. SMART is an acronym you may have heard, but we'll go deep into what each element means and why it matters. Second, distinguish between process, impact, and outcome objectives. These 3 types operate at different levels and time horizons. Understanding the differences prevents common mistakes. And third, align objectives with program theory and community priorities. Objectives don't exist in isolation. They must connect to your overall theory of change and to what the community actually wants. Let's start with a fundamental distinction: goals versus objectives. Goals are broad statements of desired end states. They describe where you want to be, improve community health, reduce health disparities, increase access to care. Goals are important for communication and inspiration, but they're too vague to guide action or measure progress. Objectives are specific, measurable steps toward goals. They describe exactly what needs to change, by how much, and by when. Goals inspire. They remind us why we're doing this work. Objectives operationalize. They tell us exactly what to do and how to know if we've succeeded. The SMART framework is the standard for writing good objectives. Let me walk through each element. Specific means the objective is clear about exactly what will change. Not improve health, but increase rates of colorectal cancer screening. Measurable means there's a quantifiable indicator. You can put a number on it, from 30% to 50%. Achievable means the objective is realistic given your resources, timeline, and constraints. Ambitious is good. Impossible is not. Relevant means the objective connects to your program goals and community needs. It's not just measurable. It's measuring something that matters. Time-bound means there's a clear deadline. By the end of year 2, by June 30th, not eventually or when we can. Let's go deeper into what makes objectives specific. Ask who. What population or group are you targeting? Adults over 50, pregnant women in the county, students in participating schools. Ask what. What behavior, condition, or outcome are you changing? Screening rates, medication adherence, knowledge about risks. Ask where. What geographic area or setting? The 3 rural zip codes, participating clinics, community centers citywide. Avoid vague language that sounds good but means nothing. Improve by itself is vague. Increase without a number is vague. Enhance is almost always vague. If you can't picture exactly what success looks like, the objective isn't specific enough. Measurable objectives include numbers, but it's not just about having a number, it's about having the right numbers in the right relationship. Include a baseline. Where are you starting? If you don't know the current state, you can't measure change. 25% of eligible adults are currently screened. Include a target. Where do you want to be? 40%. The gap between baseline and target is what you're trying to achieve. Identify your data source. How will you actually measure this? As measured by clinic electronic health records. As measured by follow-up surveys. If you can't identify a data source, you have a measurement problem to solve before your objective is complete. There are 3 types of objectives, and understanding the differences is crucial. Process objectives describe what you will do, your outputs. We will conduct 12 workshops. We will distribute 5,000 brochures. We will train 50 community health workers. Impact objectives describe short-term changes in knowledge, attitudes, or behaviors. Participants will demonstrate increased knowledge of diabetes risk factors. Participants will report higher confidence in managing their condition. Participants will increase their physical activity. Outcome objectives describe longer-term changes in health status. Diabetes incidence will decrease. Emergency department visits for asthma will decline. Life expectancy will increase. All 3 types are necessary. Process objectives without impact objectives just measure activity. Impact objectives without outcome objectives don't connect to health. Outcome objectives without process objectives don't show how change will happen. Think of objectives as a chain. Each level depends on the one before it. Your activities, conducting workshops, distributing materials, providing services, lead to process objectives. You've done what you said you would do. Process objectives lead to impact objectives because you reached people with your program, their knowledge, attitudes, or behaviors changed. Impact objectives lead to outcome objectives because knowledge, attitudes, and behaviors changed, health status improved. This chain must be logical. If your impact objectives don't plausibly lead to your outcome objectives, something is wrong. If your activities don't plausibly produce your process objectives, something is wrong. Every link in the chain must hold for the program to succeed. Let me highlight some common mistakes: confusing outputs with outcomes. Training 100 people is a process objective, an output. It's not a health improvement. Sometimes I see programs where all the objectives are about activities completed rather than changes achieved. Objectives too ambitious. If you promise to cut diabetes rates in half in 1 year, you'll fail. Unrealistic targets undermine your credibility and demoralize your team. Objectives too easy. If you set targets that will be achieved anyway without your program, you can't claim impact. The target should be meaningfully better than business as usual, and missing the so what. Objectives that aren't connected to things that matter. Maybe you can measure it, but why should anyone care? Align objectives with community priorities. Let me share an example of a complete set of objectives. Process objective. Conduct 24 diabetes prevention classes reaching 300 adults by December of this year. This is specific about what, how many, and when. Impact objectives. 70% of participants will report increased self-efficacy for diet management as measured by post-program surveys. 60% of participants will achieve 5% body weight loss within 6 months of program completion. Outcome objective. Type 2 diabetes incidence in the target population will decrease 15% within 3 years as measured by county surveillance data. Notice the chain. Classes lead to increased confidence and weight loss, which lead to reduced diabetes incidence. Each level is measurable, each connects logically to the next. Let's summarize our key takeaways. Goals inspire with broad visions. Objectives operationalize with specific, actionable targets. SMART criteria: specific, measurable, achievable, relevant, time-bound. Ensure objectives can guide action and measure progress. Process, impact, and outcome objectives operate at different levels and time horizons. All three are necessary for complete program logic. Objectives must chain logically. Activities produce outputs, outputs produce impacts, impacts produce outcomes. Each link must hold and avoid common mistakes. Confusing outputs with outcomes, setting unrealistic targets, choosing objectives that don't connect to what matters. In our next lesson, we'll explore the theory of change, the narrative that explains why your objectives chain together as they do. Thank you.